Hello, this is Dr. Susan Crutchfield with MedChat, brought to you by 950 AM, Solid Gold Soul, Metropolitan Health Plan, and Hennepin County Medical Center. And our original background music is Steve Lowry Productions. I have with me today my son. Go ahead and introduce yourself.
Hi, I'm Dr. Charles Crutchfield III. I'm a board-certified dermatologist and clinical assistant professor of dermatology at the University of Minnesota. I'm also in private practice in St. Paul with dermatology consultants. Also, right now, get a pen and paper ready because we're going to have some very important information and numbers for you to take down before the show is over.
Okay, you were in Santa Fe, New Mexico.
Just got back. Santa Fe was a very beautiful town. I like New Mexico. Great restaurants there.
Nice weather.
Oh, I also want to give credit to the background music. That's Steve Lowry and Super 400 Music Productions out of La Jolla, California.
Yeah, it sounds to me like Latin jazz. I just kind
That's
of love
what
that
he
music.
calls it, Latin smooth jazz.
Well, as your listeners know, I'm a family doc by background, and I am the medical director at MHP. And the show's format has been that we're going through the alphabet from A to Z, talking about medical conditions. And guess what? We're up to X, Y, and Z today. So it took a while to get here, like 15 months, but we're up to it. Now, you weren't here last time, and so I promised the listeners a couple of things in the W's that we might have to go back to. Let's start with W, weeping dermatitis. And this is something I got out of an older self-help book. But when dermatitis is wet, or what lay people would call weeping dermatitis, when it's wet, you dry it, and when it's dry, you wet it. Is that right? Why don't you talk about that a little bit?
Well, that's one thing that we used to get teased about a lot in residency training in medical school, because that was the old dermatology course in 1 minute or less. And that's what they said. If it's dry, make it wet. If it's wet, make it dry. If it's red, put a white cream on it. If it's white, put a red cream on it.
Well, I'm glad we have real dermatologists instead of the doctors doing that kind of stuff. But a dressing that you put on a weeping dermatitis, it would be something. Well, go ahead, talk about it.
Well, generally speaking, when you have epithelial disruption, or the surface of the skin has cracks and fissures and breakage, a lot of the serum fluids can leak out. Also, this can be very itchy, and usually it occurs with atopic dermatitis or eczema. And I like to use cool compresses and soaks with a very, very mild salt solution that will aid in the healing and also drying of the wound. It's usually called a Burroughs solution.
Do you ever then move on to something with hydrocortisone in it?
Yeah, it depends. If there's inflammation accompanying it, that's certainly something I would consider. Oftentimes, the listeners can try an over-the-counter preparation, Cordaid 10, Cordaid 5. And if that's not strong enough, or if it's not giving you the control that you need, you can contact your dermatologist or primary care person for a stronger topical anti-inflammatory.
When I was a teenager, I had a friend that really got quite a case of poison ivy, and there was some weeping to that rash, and calamine lotion was being put on it. Was that bad or good? Or
Calamine is good. It's more symptomatic. It takes the itching away, but it does not eliminate the underlying dermatitis that's driving the whole problem. And that's triggered by the oils from the rhuus plant. And rhuus there's a family of plants that include poison oak, poison sumac, and poison ivy, and that's seen across the United States. So you really need to turn off the immune response in the skin, and oftentimes the only thing that will do that are oral medications. You can't control it topically, and that's when you need to see your doctor, because all of these are prescription strength.
The other thing that came up last week, I was giving some advice about warts, particularly warts on the fingers of children and planters' warts. And I was saying the first thing people usually try, Dr. Mom, is go to the drugstore, get some over-the-counter kind of medicine, like Compound W. And if that doesn't work, I even told the story again about my white wool socks when I had planter's warts as a kid. Because my little granddaughter Mahogany has a plantar wart. And I said, okay, get some white wool socks. And she was just paying a lot of attention. Actually, they went away. Now, whether they would have gone away without the white wool socks, one will never know. But if they come into you for professional dermatological treatment for a wart, then what happens?
Well, I tell my patients that the list of things to treat warts is about a mile long. And anytime you have a list of treatments that long, that means nothing on the list works that well. And warts are very tough to treat. One of the old-time famous dermatologists said there's nothing that ruins the reputation of a dermatologist more than the average wart, because they are so hard to treat, and they're caused by a virus. So technically it is an infectious disease, and it can spread, and depending on the location, it can be cosmetically unacceptable, but also can be very, very painful. It can break down and get infected too. So because it's an infection, I like to treat warts. Now the key to treating warts, be it the wart that you get on your hands, a kind of rough bump, around your feet, the plantar warts. And I'll talk about some other warts too called molluscum. We've talked about that in the past, but those are technically warts caused by a pox virus, which is a slightly different virus, opposed to the human papillomavirus, which produces the common warts. But anyway, what you want to do is irritate the wart enough so the immune system gets angry at the wart and kicks in and gets rid of it. Oftentimes, depending on even your health status, your immune status, your nutritional status, things like that, they can make very minor changes in your immune status, which can actually cause your immune system to get rid of the warts. And that's a real good example in kids. Sometimes, not always, but sometimes, if you leave the warts alone long enough, something will change in the nutritional or health status of the child that will kick the immune system in and get rid of the warts. Hence the old story, wearing white wool socks. What you're really doing is buying some time so the immune system, for whatever reasons, will kick in and get rid of the wart.
Or maybe that wool was just irritating that.
Maybe the wool is even a mild irritant to the wart also. So there are a lot of things you can use to irritate warts. Like you said, over-the-counter preparations like Compound W. You can get prescription medications. You can freeze the warts. You can burn the warts. And what I'm doing now that seems to be particularly effective are two things. Number one, and this is a cutting-edge tool. It's been used in Europe now for a couple years, but it's called squaric acid.
Well, you know, little Mahogany, my granddaughter, when she moved along off the white wool socks, and I said, well, let's call your uncle the dermatologist. And you told her I've got the cutting edge. All she heard was cutting. And she says, oh, no.
I don't want any cutting on my warts.
So then when you explain further that this is a medicine that you just rub on it or put on it, then she's fine. She's with the program now.
Well, I'm glad that we talked about poison ivy a little bit ago, because this squaric acid, when I use the term acid, it's not a burning, foaming acid that you think of. It's a very mild acid, just like the acid in lemon juice is an acid, but that doesn't burn through the table or anything like that. But for some reason, this product is very similar to poison ivy.
Oh, it is.
So what happens is, and with poison ivy, you develop an allergy to the oils in the plants, and your immune system attacks whatever touches that oil because it's trying to get rid of a foreign invader. So what you do is you paint a little bit of this liquid on the warts, and your body gets sensitized to the warts, very much like poison ivy, and you get a little allergic reaction, just like poison ivy, right where the wart is, so the immune system comes in and attacks the wart.
I always can picture those white cells coming in, phagocytes to attack.
So this is a new cutting-edge treatment. It doesn't hurt at all. So it's really great for kids because a lot of the other wart treatments can be very problematic. Now, for some of the older patients or resistant warts, I'm doing a lot of laser treatments. And I'm going to give you a number to call, so have a pen and paper ready, so if you have any questions on this, you can give us a call too. But warts are really something to treat. Now, there's another one called molluscum, and those are caused by a pox virus. Those are little smooth, dome-shaped papules with a little central dent or umbilication in them. These are commonly seen on the face and arms and body of small children, and they run rampant through schools and also daycare. They don't have any long-term health effects. They look a little bit funny, but rest assured, it's a completely normal part of childhood, just like getting a cold or the flu or growing up.
So you don't keep the child home from school or daycare till it clears up?
I don't, and it's mildly controversial, but because it doesn't have any long-term health effects, I generally don't restrict activities of the children. And they're so common, you'd have probably 2 to 3% of all kids at home then.
Yeah, I've thought about daycare, especially daycare, where a lot of kids have upper respiratory infections, common colds, runny nose. If you would keep everybody home that would have molluscum, a cold, URI, you wouldn't have a whole lot of people there. But that's why kids that are in daycare seem to catch these kind of things more than kids that are home with just mom, etc. Let's go on now. We're up to the letter X.
Oh, I want to give a number too.
Oh, okay.
So if anybody has any trouble with warts or resistant warts that over-the-counter preparations aren't handling, give me a call. The number is 651-645-3628. And make an appointment. We can talk about different options because warts can be very problematic. And we'll give that number again later in the show.
Okay, starting with X, and here's a good one. Xanthoma. Xanthoma. A friend of mine had this when I was working over at Prudential, and she had these yellowish plaque kind of bumps under her lower eyelids, both sides.
Both sides, and top and bottom. And this, some people call these xanthomas or xanthelasma. These are cholesterol deposits in the skin. Now, you can get xanthomas in other areas of the body, like over your tendons and your Achilles tendon behind your ankle, also the tendons in your elbows. You can also get them anywhere, in the creases of the palms of your hands. You can get them on your buttocks. You can get them on your body. Also, you've probably seen this, and if you haven't, look around, especially in the more senior people. They get rings around their irises. So you look where the color is
Yes.
in the eye, and there's a white ring that goes all the way around. That, too, is a cholesterol deposit in the eye.
Arcus senilis.
Yes, that's exactly what it is.
I have that. Oh, no.
No, you don't have Arcus senilis, do you?
Oh, good. I don't know.
Anyway, now, the thing I wanted to bring up, and why I was rambling on about all these different types of xanthomas, when you have xanthelasma, which are these yellow, flat plaques above and below the eyelids, and you've probably seen this, it is a cholesterol deposit, but it does not mean you have a problem with cholesterol in your body. For some reason, in just some patients, cholesterol likes to form there. However, with the other xanthomas, those do indicate an abnormality of lipid and cholesterol metabolism. So when you see them in other places, you need to have a good primary examination to find out what exactly is wrong that's causing these deposits of fats in the skin.
But now that Arcus senilis, you see it in a lot of older people, so
Yeah.
I don't know if that means...
No, Arcus senilis and also the xanthelasma, the plaques on the upper and lower eyelids, usually are not indicative of abnormalities. Now, the thing about xanthelasma, they can be treated.
Oh, yes.
Yes, and I treat this all the time, and we use a topical preparation that kind of melts them away over 2 or 3 treatments.
Oh, they don't have to be excised.
Nope, they don't have to be excised. You can just put a topical liquid that melts them away. And once again, when we give the number at the end of the show, if you have that problem, give us a call and we'll talk more about treating it for you.
Can you think of any other dermatological disease that starts with X?
I was on W,
Okay, back to W then.
wine, port wine stains.
Oh, yeah, port wine.
Port wine stains. And Gorbachev was very famous. He had one of those on his forehead. Those are the flat red patches that people can have anywhere.
Deep red.
Deep red. And they get deep. And I'm glad you brought that up because they become deeper red with time. They're much easier to treat when they're pink or light red. But with time, they become thicker and much darker, and they're very difficult to treat. And I think this is one of the greatest treatments for the laser that we have. And with several sessions of laser treatment, you can clear these up completely.
Is that right?
I've had several patients that have had port wine stains on their face, and they've come in for laser treatment, and it's actually changed their outlook in life.
Oh, yeah, it's not cosmetic in my viewpoint.
No.
Some insurance companies will try to not pay for this correction. To me, this is something that is reconstructive. It puts you back to looking normal. It makes such a difference in a person. And I've seen babies. Now, certain babies will, as they get older, get rid of some of the redness in some hemangiomas.
Mm-hmm.
But if it's a very large area, like a quarter of the face, this sort of thing, I don't know at what age in a young child you determine whether they need to be treated. What do you
Well, I
think?
mean, this is a great question. And the funny thing, just coincidentally, my last patient of the day was a 6-month-old with this huge port wine stain. Now, smaller ones, sometimes they call it stork bites, and a real common is a little red dot about the size of a penny
Yes.
between the eyebrows,
Yes.
right on the upper part of the nose. That's called the glabellar region, and it's called a glabellar nevus flammeus or glabellar stork bite. Well, the baby I saw had one, but it covered the eyebrows and the nose and the upper lip.
Oh.
And the
That's why I'm glad as a family doc I have specialists like you that I can say to the parents, now this is a little beyond family practice to decide. Here is a number.
And that's what they came in for. Their family
Right.
practitioner said, I want you to have a consultation with one of the dermatologists about this. So the question is, when do you treat it? Do you wait? Because sometimes as kids age up to 1 or 2 years, they get a lot better.
Yes.
But the problem, this one is pretty extensive, and everybody that handles a child is kind of shocked. And the parents,
Mentions it.
they say,
yes. What's
child
wrong?
abuse? Did
Right.
you hit the child? Did it fall? So we're actually going to do a little test spot with a little topical anesthetic in the next week or two about the size of a quarter to see how that responds. But I've had other patients. I had a girl in particular. She was 9 years old, and she had one covering half of her face. And, as a 9-year-old, kids can be very cruel. And her mother said that she was teased incessantly in school, called every strange name you could think of.
Sure, I can see that.
To the
Children
point-
aren't diplomatic.
No, to the point where she didn't even want to go to school some days. Her mother would say she'd stay in her room crying, saying, I don't want to go to school because they tease me. Well, we've done a few sessions to get rid of her port wine stain with the laser. You can't see it at all anymore.
Really?
Her mother said it's changed her outlook in life. She's got a whole new circle of friends. She's playing all the time, can't wait to get to school, and it's made a big difference. And thank goodness, you brought up the point that insurance companies have been resistant in the past. Recently, a group of dermatologists have gone to the state legislature, and there's a new law in Minnesota.
Is there?
If you have a port wine stain and you have insurance, if your insurance company is going to operate within the state of Minnesota, they have to cover port wine stains.
Well, as a health plan, we were ahead of the law because I always said we should pay for them, so we never had that.
And you can have them anywhere. Yeah. So anyway, here's a number. So if you do have a port wine stain that you want evaluated to see what options are available, you can call me, Dr. Crutchfield, at 651-645-3628.
That's Dermatology Consultants in St. Paul.
In St. Paul. So what else is on our list?
Okay, zinc tablets. Now, here's a fun one. I had a coworker who said zinc tablets work. She said she heard about it from her relatives and her neighbors, and she was skeptical. But a cold was coming on. She had that sore throat there, little sniffles. She got on these zinc tablets, and what do you know? It went away. No cold. And so, as she was describing this, that very day, I was feeling a little sore throat and a little stuffy nose. I went home and I got my husband's zinc tablet. He believes in them. And really, he hasn't had a cold since I can't even remember when. So I took his zinc tablets, and you know what? I don't have a cold. So what do you think of that?
Well, I think it's interesting. And, you know, zinc is near and dear to my heart. It is, and I'll tell you why. But first of all, with the zinc tablets, the original study was done on a small group of patients, I think maybe 10 patients that had colds. And supposedly it shortened the length of their colds from 5 days to maybe 3.5 or 4 days. So supposedly their colds got better a day sooner. However, the study size was fairly small, and it's difficult to extrapolate those numbers into statistical significance. But the thing that really made me standoffish is that the person who published the study had stock in the zinc company. And they became millionaires after this study was published and these zinc tablets hit the market. Now, do they work? Maybe they do. I haven't tried them. I know the old thing that was touted.
Vitamin C.
Vitamin C. That was the cold cure-all.
That's close to your heart.
That's near and dear to my heart. And I'll get back to the zinc story in a second. But vitamin C was put forth as the cure for the common cold. Most listeners have heard of this by Linus Pauling.
Right.
And Linus Pauling is a very well-respected doctor both in medicine. You know, the thing about Linus Pauling, he is the only person in the history of the world to win 2 unshared Nobel Prizes.
That's very
There have been
impressive.
people that have won Nobel Prizes, but it's usually as a group. He won them all by himself and didn't share them with anyone. The first one was in medicine for his discovery of organic chemistry. He actually developed that branch of chemistry. The second one was not even in medicine at all. It was in peace.
Peace.
He won the Nobel Prize for Peace unshared because in the 1950s, during the big atomic bomb race, people were doing nuclear testing above ground. You've probably seen these pictures of these mushroom clouds when they're exploding bombs in the desert.
Yeah.
He calculated the amount of radiation that was being thrown off into the atmosphere by all the nuclear testing, and he calculated that it would kill tens of thousands of people on an annual basis due to radiation fallout and increased levels of cancers. As a result, the governments of the world band together and decided to do all their testing underground. And now you've probably seen that. All the tests, the ground kind of shakes and you see a shock wave, but all the radiation is contained. And he has saved millions and millions of lives by talking about the radiation problems. And so he won the Nobel Prize for Peace.
And you met him personally.
I met him personally. He was about 90 years old.
And he came to the Mayo
Clinic. And he came to the Mayo Clinic when I was a medical student and in
Yeah.
graduate school there to give a talk. So I was also assigned to be his escort and to drive him places and meet him and take him to the different conferences. So I set up a meeting with all the professors there, and I thought, I'm going to have lots of good food here.
Right.
So I ordered this big tray of all these oranges and grapefruit. I thought we're going to have lots of vitamin C here. We also, on the smaller side, we had some muffins and some bagels and cream cheese and butter. You know what he went right for?
The bagels.
He went right for the bagels. He said, "Bring me extra butter." He never touched the oranges. However, he did take vitamin C supplements every day on his own. He was taking large doses, probably more than 10 to 20 grams a day, which is a lot of vitamin
That's
C.
controversial.
It's
I've
very
seen
controversial.
articles saying that doesn't work, etc. But
So I talked to him and I said, "Hey,
yes.
what do you think I should take for?" And his big thing now is for the prevention of cancer. And there are certain vitamins that are actually called free radical scavengers. Free radicals are chemicals in the body that actually attack the DNA and break it down and can promote cancer. And these agents can actually quench them, like throwing a blanket around them so they don't do their damage. And those are vitamins A, C, and E.
Right
Those are
now,
the 3
what
vitamins.
about antioxidants?
That's what they are. They're antioxidants.
Oh, that's what everybody reads
A, C,
about
and E.
in women's magazines.
Right. So vitamins A and E are fat soluble, so they travel in the fat parts of the cell. And vitamin C is water soluble, so it travels in the water content. So between the two, you'll have all the cell covered with antioxidants. But anyway, he was the first one to propose that would help prevent cancer. So I asked him how much vitamin C I should take, and he told me you need 3 to 5 grams a day. So of course I ran out to the health food store and started taking this vitamin C, just like you did with your cold and the zinc lozenges. And 3 days after I started the vitamin C, I got the absolute worst cold I've ever had in my life.
No.
I mean, it was terrible. I can't even imagine a cold that was ever worse than this.
Oh, well,
So
what
I remember,
does that prove?
Well, all my friends were teasing me. They said, a lot of good that vitamin C did for you. But you know what I told them?
What?
I said, can you imagine how bad my cold would have been if I hadn't taken the vitamin C?
A great story.
So that's
Great story.
my vitamin C Linus Pauling story. But now back to the zinc, why it's near and dear to my heart.
Okay.
There's a spray, and there's a big controversy over this. It's called skin cap spray.
Oh, yes.
And that was the rage in medicine a couple years ago. For the treatment of all kinds of eczema, especially psoriasis.
Psoriasis.
And it said that its active ingredient was zinc. And we actually did a huge study at the University of Minnesota, almost 100 patients enrolled, to treat this new topical zinc spray to see how it worked against psoriasis. And it worked better than any topical medicine we'd ever used to treat psoriasis. It was the wonder drug. It had people in medical circles and dermatologic circles around the country, if not the world, talking about this new over-the-counter wonder drug to treat psoriasis. No one had ever seen anything like it. We'd been giving people chemotherapeutics, methotrexate, which we used to treat cancer.
And tar treatments.
Tar treatments, lights, in the hospital 3 weeks, and none of this worked as well as this new topical spray.
It was good. I remember that. I remember seeing slides. You had slides of people before and after.
I mean, I had one guy, he came into my office. He had had psoriasis for 27 years.
Quite a long time.
He lived across the street from Lake Nokomis here in the cities, and his legs were so bad he would never wear shorts to walk around the lake. All summer long, he'd walk around the lake with long pants on. And we cleared his legs up, and he wore shorts for the first time in 27 years, and he told me he forgot what it felt like to have the sun be on your legs when you take a walk around the lake on a nice sunny day. And he started crying in my office. He said, I forgot what that felt like.
Sounds like a miracle drug, all right.
And his was not the only story. I had many other patients actually come to tears. Well, when something's working this well, if it's too good to be true, it probably isn't.
It sounds good, too good to be true.
So I had a special analysis done at the Mayo Clinic, and unfortunately, it broke my heart. The company based in Spain was actually putting a steroid into their spray. The strongest prescription strength steroid available. But because it was manufactured in Spain, and no one was overseeing the manufacturing process except the company, and then they were selling it over the counter. Anybody could buy this. Just call a number, they'd send it out to you.
Well, what's the problem? If it really does help psoriasis, so it's got the strong steroid.
It does. But the problem with steroids is long-term effects can be very deleterious. For example, you can develop Cushing's disease, you can have heart attacks, strokes, it can cause your skin to break down and bleed and crack and infections. It can cause adrenal gland shutdown, where you actually go into an adrenal crisis and die. That's why it needs to be used sparingly and with the supervision of somebody that knows the side effects. And a lot of patients, if you had 1 or 2 spots on your elbow or knee, you spray it a few times, it clears up, not a big deal. But the problem that we had, there are a lot of patients with extensive psoriasis, and they're recluses.
Yes.
So they're ordering this through the mail. They're basically taking a shower in it every day without any supervision, and when they stopped, they had all kinds of catastrophes.
Did that happen over in Spain?
I'm not sure. But anyway, the FDA stepped in and they banned it. So the topical zinc spray for the treatment of psoriasis, which was maybe one of the greatest discoveries, turned out to be a bust.
Oh.
So anyway, that's how we got to the zinc story that I said it was near and dear to my heart, because I was a leading researcher on the program at the University of Minnesota for almost 2 years.
Yes. It did seem like it was the answer.
Mm-hmm.
I want to catch a Y subject. Yeast infections.
Mm-hmm.
I'm going to talk about them for women, and then you can talk about the other kind that might be in the skin. A vaginitis, and most women have had a yeast vaginitis. They know that it's an increased vaginal discharge that looks kind of like cottage cheese. There's itching, and there's often burning when you urinate. This is not necessarily a sexually transmitted disease. It's often a follow-up of taking certain antibiotics which change the environment of the vagina and allow the yeast to take over and cause a yeast infection. There are good over-the-counter treatments for this. There's a one-time treatment. There's a 3-day treatment. There's some of it's in the family of Lotrimin or Monostat. Check out with your pharmacist the over-the-counter things. And then, of course, if you go to the doctor, if it doesn't work, you go to the doctor. And there are treatments that your doctor will give you for this. Some of the things to do to try to prevent getting it: wear cotton underpants so that there's good circulation, air circulation. Don't wear really tight-fitting pants. Avoid those feminine sprays, deodorant sprays, and a douching, which older women might have done. Change tampons regularly during your period, and remove any contraceptive devices on time. So those are some tips as far as yeast vaginitis. What about other kind of yeast?
Well, I see it too on men, on the tip of the glands of the penis, especially in uncircumscribed men, where the skin folds over, uncircumcised men, where the skin folds over, and there's a moist environment where yeast can land and start growing. So it's very common. My personal preference, and I realize that this is very controversial, but a lot of parents have to decide if they want to circumcise or not circumcise their child, their male baby. I recommend circumcision.
I do too.
Yeah. I think for the most part it's a decision that I've never met a patient yet that told me they wish that they had not been circumcised, but I've met many, many patients that have told me I wish that I was, that
That's
we're not.
true.
And I've never seen it the other way around.
It's a religious thing in some religions and cultures, but there have been literature studies in the pediatric group to see if they get more urinary infections if they're not circumcised, and indeed there is a little bit of higher risk of that.
Yeah. And also patients that are taking oral antibiotics for acne treatment sometimes can have problems with recurrent vaginal yeast infections, and I recommend just the one-day treatment once every 2 weeks as a preemptive measure while they're being treated for their acne. Now, another thing that we talked about earlier were the greatest inventions of the century.
Oh, we have to give the answer.
Yeah. And then I'm also going to talk about wrinkles. That's my last W.
Okay.
But the answer, we've come up with several answers, including television, and that certainly has to be way up there. Television, telephone,
computers.
And computers.
Yes. And medical science.
And medical breakthroughs. And automobiles.
Yes.
And airplanes.
Right.
And radios. Just the way you're listening to it.
It's hard to stop.
It's hard to stop. But one thing that ties most of these together are electronics.
Yes.
And the harnessing of electricity and the processing of electricity in a fast mode, and that would be the microchip.
The microchip.
So I think we say that the microchip is driving all these industries now and allows communication and things to happen on a scale that we never dreamed of before.
Yes.
So
That's right.
I think the microchip has it.
I think so too. I'll agree with you as we go into the next millennium.
Okay. Now, the last thing I'm going to talk about are wrinkles.
Mm-hmm.
I see this all the time. Patients come in and they want to get rid of wrinkles. And one of the newer treatments that dermatology has to offer are alpha-hydroxy acid treatments. Now, once again, these are acids very similar to acids found in fruits, like lemon. So it's not the burning acid that you find in a battery.
It's like a facial peel?
It's like a facial treatment. They used to use a real strong acid before and the skin would peel off. But now, it's a very light desquamation. We spread it out over several months. Patients are very happy. And the acid itself is derived from sugar cane.
So then it certainly isn't an acid like you'd think of,
No.
and it's more like lemon juice, like you say.
Exactly.
Does it make the face get red?
It makes the face a little bit pink for a day or so, but it does a lot of things. It takes away superficial wrinkles, it makes the skin thicker, and it takes away uneven color and freckles on the face. So,
How soon do you notice it after the treatment?
It's a 6-week program. Patients start noticing it after a month or two.
Mm-hmm.
So anyway, there's a great new treatment for wrinkles, and we're going to give you a phone number in just a few seconds, so have pen and paper ready. So if you have any questions about anything we've done or comments on our last show here, especially dealing with port wine stain, laser treatments of port wine, warts, and wrinkles.
Right. And just a last bit of advice for me. Look at how many medicines you're taking and try to cut down on them. Get rid of medicines that aren't really crucial. There's so many prescriptions being written in this country today. 8 prescriptions. And so for every man, woman, and child, cut down and do lifestyle changes instead.
Okay, and so the number is 651-645-3628. 651-645-3628. So we wish you well. Thanks for listening and have a solid gold
week.
millennium.
Right.